Hi everybody, I'm Dr. Tamara Cumming, a senior lecturer at Macquarie University. I'm meeting today from Wiradjuri country.
And I'm Sandie Wong. I'm a professor at Macquarie University here on the beautiful Warramadigul campus of the Darug Nation.
Educate. Our project is based on a holistic model of well-being, so it looks at both the psychological and physiological aspects of individual well-being, and then it looks at how those aspects sit within and interact with an organisational environment, and then within a larger socio-cultural, historic and regulatory context. So we have lots of sub-projects that go on within that larger overall project. And you might be surprised to hear that despite this ongoing concern with early childhood educators' wellbeing, and especially given the shortages that we're experiencing in Australia at the moment, and you might be where you are as well if you're not in Australia, there's actually very little evidence about what works to support and sustain educators' wellbeing. So as one way of looking at that, Sandie led two projects which look at clinical supervision as a potential way to better support educators and to support better workforce stability. So I might start by saying, Sandie, what is clinical supervision?
Yeah, it's a term that's not familiar to us in early childhood. In clinical supervision, supervisors who are qualified psychologists or counsellors, they aim to provide these safe, secure, trusting spaces that enable the supervisee to reflect on their practices and their interpersonal relationships and the personal and the organisational factors that actually impact on their work. So it's really about reflecting and reviewing to help the supervisee to process their emotions, to assist them with coping, and to relieve that work-related stress that we know all too well is evident in early childhood.
Fantastic.
It's important to know that it's actually different from mentoring and coaching, and it's usually delivered by somebody who's external to the organisation. And whilst early childhood educators now, quite a lot of people have access to the employee assistance program, and particularly in times of distress, the thing about clinical supervision is that it's marked by ongoing reflection. And despite it being really common in other similar professions like social work, it's not been a tradition in early childhood. But some organisations have actually started to deliver this now, to provide clinical supervision for their work as a way of supporting their staff.
Yeah, so wonderful to know that that's happening. And in fact, that gave us the opportunity, didn't it, to look at how clinical supervision might be helping people in a couple of situations. So can you tell people a little bit about why the research was done and what was done in the research?
Yeah, so as you pointed out, Tamara, despite our concerns with educator wellbeing, there's not a lot of evidence about actually what works. And so when we saw this opportunity to evaluate clinical supervision in two different contexts, so we did two studies. One was clinical supervision that was provided to centre directors who are working in services that are in quite complex areas where there's higher amount of disadvantage, was one project. And another project was a case study of when clinical supervision was offered in a time of natural disaster. So supporting educators through a flood that happened.
Fantastic. Two really important situations. And I think something that educators frequently find themselves in those situations these days, certainly in Australia. Yeah. So can you tell everyone a little bit about what we found, please?
Well, ta-da! It works. Clinical supervision works. So if we combine the findings from both of those studies, what we found is that it actually improved, clinical supervision improved the centre directors. Both these studies were with centre directors, and it improved their health and their well-being, particularly their emotional well-being. It enabled them to deal with these traumatic events that happened either as a result of the flood or the result of working with families in challenging and complex situations. But more than that, it increased their capacity and their ability to effectively communicate, to lead their teams, manage the difficult situations, and to meet the needs of the children and families. It also increased their self-efficacy, their professional identity and sense of professionalism. Gave them feelings of empowerment and confidence, and increased their job satisfaction. And not surprisingly, all of those things meant that it actually sustained centre directors in their work, and it contributed, therefore, to retention.
So what would you say are the take-home messages for people maybe who are thinking about introducing clinical supervision in their own service, or perhaps they're a bigger service provider?
Yeah, there's a few things. So as I said, clinical supervision is offered in other professions, but for it to work in early childhood, first of all, it has to be best practice supervision. So it has to be trauma-informed, relationships focused. But it also has to be delivered by supervisors who understand the early childhood context. That's really critical. And in the context of natural disaster, the clinical supervision actually needs to be there at the time of disaster, but also ongoing, because some of the challenges that we found with when your educators are facing natural disaster, they could deal with it in the immediate aftermath, but it wasn't until later that some of the trauma started to come out. So it has to be ongoing. So that's a really important part. It needs time, and it needs space to actually receive the clinical supervision. And I think one of the other things that we need to think about as well is actually receiving clinical supervision is a skill in itself, and particularly in a profession when it's not something that is very kind of understood very broadly or common. So educators themselves need the skills to be able to receive the clinical supervision.
Yeah, so a lot more than just maybe turning up once to have a bit of a chat to someone, or picking up the phone to someone who doesn't really understand the early childhood context.
Yeah.
I think I also remember one of the problems was a lack of private spaces, whether that's to talk to someone, you know, by phone or Zoom or in person, that unfortunately early childhood services often don't have those private spaces. That's part of that point about spaces, I suppose. But I mean, given the shortages that we have, and the need to support educators in their complex work, even during regular times, it certainly sounds like clinical supervision is a very promising approach to helping support educators, and to support retention, but also to assist educators with their well-being, that they're able to process those difficult parts of work. I wanted to mention that if people wanted to read more, there are 2 journal articles available on this. So the first one was published in the Australasian Journal of Early Childhood, I think at the end of late last year, and the second one just very recently in a journal called Cogent Education. So we might just put those on the screen after we finish speaking, in case you'd like to read all of the details about how the study was done, and importantly, what it was like for the people who were participating as supervisees, and what can be done if you want to introduce that approach yourself.
Yeah, and both of those papers are free access, so we'll make sure that we'll have the links available for anybody who wants to read more.
Fantastic. Thanks, Sandie.
Thanks very much. Bye.
Bye.